Look up to the sky and I give him my thanks. Start my day to it's gotta be done. Don't forget where I came from.
Hi, Karen. I'm just here to see April, the nurse. Come on.
Hi, April. Your 9 o'clock appointment is here to see you.
It's really important to be well prepared before your patient comes in, as this helps to set their confidence in you, especially if they're nervous about having needles or having anxiety about why they're receiving the tuberculin skin test. Supplies you will need to plant a TB skin test include 1 cc tuberculin safety syringes, alcohol pads, cotton balls, a sharps container to dispose of your syringe after you plant the TB skin test, a cooler. All Tubersol needs to be maintained within the cold chain between 2 and 8 degrees. You can do this by having a cooler at your desk. Always ensure you check the expiry date of the Tubersol before administering. As well, you will need an anaphylaxis kit. All patients are required to stay for 15 minutes after receiving the skin test. The standard forms to have on hand when performing TB skin tests are the 939 and the Aboriginal TB Program Monthly Report form. The 939 is used when a patient has a positive TST. This form also serves as their chest X-ray requisition. The patient fills out the first part of the form and the nurse fills out the second part of the form, which outlines such information as risk factors, signs and symptoms, and TST history. Some patients may require the 939 form for medical, treatment, or employment purposes. The Aboriginal TB Program Monthly Report is used for recording community TST screenings and results. Remember to record the month, year, and the name of your health center and community along with all mandatory patient information. This form is to be sent monthly to TB Control. If no tuberculin skin tests were done in a month, please submit a nil report. It is important to provide your patient with appropriate education and materials that explain tuberculosis and the tuberculin skin test. Providing resources for your patient should include information on signs and symptoms of TB and the risk factors for active TB disease. Hi Sharon, how are you?
I'm good.
Good. So you've come today to have a skin test done?
Yes.
Okay. And can you tell me why you need to have the skin test done?
I'm planning on going to treatment.
Have you ever had a skin test done before?
No.
No? Okay. Have you ever known anybody with TB?
No, not necessarily.
Okay. Well, what I'm doing today is just going to plant a little tiny protein into your arm. So just a little tiny amount just under the skin. And what it's going to do is tell me if the TB germ lives in your body. So if you have a positive skin test when you come back on Friday, it'll simply be a bump on your arm. Okay, but don't worry, it just means that the TB germ is living in your body. It doesn't mean that you can't go to treatment. It doesn't mean that you're contagious or that you're going to make anybody sick. But what it will mean is that you need to go and have a chest X-ray done. Before administering a tuberculin skin test, make sure that the patient can return for a read within 48 to 72 hours. If the patient cannot return, do not administer the tuberculin skin test. Do you have any questions before I get started?
If I do have TB, what can I do about it?
All patients who test positive for latent TB infection require a completed 939 and a chest X-ray. The TB control physician reviews the chest X-ray and the risk factors identified on the 939 to determine if preventative treatment should be offered. However, if you are healthy, there's only a 10% chance over your lifetime that that germ will actually wake up. Okay. So do you have any of the risk factors? Review TB risk factors with the patient. Talk about what active TB disease is. Reassure your patient. Check that the patient can come back within 48 to 72 hours before administering the test. Thoroughly wash your hands before administering a tuberculin skin test. On a firm surface, have the patient extend their left arm, palm side up and slightly flexed at the elbow. Measure approximately 2 to 4 inches below the elbow on the forearm for the injection site. Clean the area with an alcohol swab. Examine the PPD vial, checking for product and expiry date. Write the date opened and your initials on the vial. Wipe the top of the PPD bottle with an alcohol swab. Insert the needle into the vial. Drop more solution than required to ensure that when air bubbles are removed, 0.1 ml remains. Stretch the skin taut at the selected area on the patient's forearm. With bevel up, insert at a 5 to 15 degree angle so that the entire bevel is covered and is seen just under the skin. Slowly inject the solution. You should feel a firm resistance as a pale wheal begins to form. Immediately following administration, discard your syringe into the sharps container. If there is a small drop of blood, simply blot the area gently. Do not cover the site with a Band-Aid. If you need to repeat the TST, do so at least 2 inches from the first site that you administered the TST. Once you finish planting the TST, remind the patient that they need to come back for their scheduled reading. Explain to the patient that the site may have mild itching, swelling, or irritation, and these are normal reactions that usually resolve within 1 week. Inform the patient that they are required to remain in the clinic for 15 minutes following the skin test. This is to ensure that they have no adverse reactions. 25-2, you can just pop in, let me know you're on your way, and I'll see you on Friday afternoon at 2.
Okay.
Okay.
All right.
Reading a TB skin test is quite an art, actually, because it's not what you might think. If you saw a big red area, you'd automatically think in your head, this is a positive skin test. But it's not the redness, it's the induration, which is kind of like a little raised hive area. And you can have redness and no induration, which is not a positive test. Or you can have induration and no redness, and that is a positive test. So it's important that the person who's reading the skin test really knows what they're looking at.
Supplies needed for reading the tuberculin skin test include TB skin test caliper ruler, pen, alcohol swab, 939 forms and/or the Aboriginal Monthly TB Report form, educational materials, and sputum containers. Within 48 to 72 hours, a patient will return to have their TB skin test read. Inspect the TST site in a well-lit room. It is important to note that the site may have some erythema or redness, but this should not be measured as you are looking for a raised formation or induration. No induration indicates a negative skin test. Although there may be no induration, there may be redness or small bruising at the injection site. The presence of induration may indicate a positive skin test. Begin by gently palpating the site with the pads of the fingertips, sensing for induration. If induration is present, gently zigzag your fingertips over the area to outline the edges. Place your fingertips on the outer edge of the induration and mark this edge with a pen dot. Repeat on the other side of the forearm to mark that edge. Take the TB skin test caliper ruler and place the 0.0 millimeter line inside the left dot edge and read the ruler line to the inside of the right dot edge. This will be your measurement in millimeters of the induration. A 5 millimeter reaction is considered positive when there has been a recent contact or if the patient is immunosuppressed. 10 millimeters or greater is considered positive otherwise. Report this number on your 939 form. Remember to record the exact measurement of induration in millimeters. Do not simply record positive or negative. Hi Sharon.
Hi, April.
How are you today?
I'm good.
Good. So we're back to read your TB skin
Yeah.
test. How's your arm been feeling?
It's been feeling okay.
Okay. So I'm just going to take a feel of it. There's some redness there, but what I'm actually looking for a positive is a bump or an induration, we call it. So although you do have some redness here, you can see right there, you do not have an induration. So that means that you have a negative skin test. So I'll just fill that in here. So this I'll give you a copy. Pink copy is for you, and you can take this and add this to your file for your medical file for the treatment center. Okay. And I'm going to keep one on file here at the health center, and the other one I'll send down to TB control. Okay. Do you have any questions?
No.
Okay. Well, good luck with your treatment.
Thank you.
And the great big sea got me to the things that I wanna be, but I'ma keep my heart, 'cause being native's the key.